Hey, it's Chris Bowling.
Chris Byer. What's up, CB?
Oh, we got a good topic today.
Yes.
We are going to talk about purchasing healthcare correctly.
Okay.
Something that you do a good job asking CFOs questions around this topic. And I love how you always phrase it. So why don't you kick that off for us?
We've been talking about this for quite a while, as we try to dissect what goes into a healthcare program. It's not just the insurance benefit or the insurance carrier, but this goes back to some coaching we went through probably in 2017, 2018. So I don't know if this is officially trademarked yet by anybody that's doing this from a coaching program, but they talk about the supply chain of healthcare.
Yeah.
And when you're talking with a CFO, it's their responsibility to help their business be as efficient as possible, to purchase the inputs for whatever they're making or delivering as cost effectively as possible. And when prices go up, they negotiate. I mean, we work with a lot of municipalities and government entities that are constantly going out for RFP to purchase police cars and office supplies and things at the best price for the best quality. But I think, again, it's something that often gets overlooked when a health plan is not being looked at as a supply chain component. I think it's topical right now. We're all going through inflation.
It is. Yeah. And I think we're in a state, we're dominated by two carriers, our Blue Cross Blue Shield and UHC. Our Blue Cross is an ASO. So it's a box. Here's your box, take it or leave it.
Yep.
Hard to shop every input inside that box because they don't allow you to, which I think the UHC side, we would prefer UMR and still limited, but you do have the ability to start carving out some things and really finding that best in class, whatever that is.
And you think through that if a CFO got an invoice for inputs for their manufacturing company and one day it was $60 for that part that they need to put into the machine. The next week it's $600. We're gonna totally stop and we're gonna figure out how we renegotiate that, find a different supplier, because there's no way we're gonna pay 10 times as much for that specific part when we can get it for the price we've always been paying. And I think that we started to unpack that a lot for our clients, regardless of their self-funded third-party administrator. The concept is really, there are 7 or 8 different components of the health plan. Why are we just letting those be delivered to the employer? Let's figure out what's the best for the best price and help that employer purchase each component less costly. You love prescriptions. You use that as a topic all the time.
Yeah, and I'm very excited what you and I have rolled out here at the end of last year is, let's say you are in that ASO plan and you're not able to carve out your PBM and you've got high cost drugs. You and I have created a way that we can take those 2 or 3 medications that are killing your health plan and source those through a different avenue and get that $20,000 drug down to 8. So, I think that's a perfect example about how can you and I help that CFO identify areas where there's an opportunity and let's find that solution for them.
Absolutely. And I think, we're still limited from the consumer standpoint on how easy it is for them to decide where to go for care. It's getting better, but it's still not simple. It's not like hopping on Amazon or Walmart.com and shopping for the best price. You really have to know what you're doing. But at the same time, we found some programs that, incentivize that employee or that family member to make the right choice by waiving their cost share. We're not limiting their care. We're not, the employer's not telling them they can't go to a certain location, but if you make the right choice and you help the plan save money, we're going to waive your cost share. And that carrot approach has been extremely successful.
It sure has.
So it's, a lot deeper than just today's discussion because it depends on every employer. But if you are a CFO or a CEO or an owner of your company and you're not managing your benefit plan as a supply chain and looking at how you're purchasing the inputs, reach out to us because it is not something that's terribly difficult, but it does take extra work to get started.
Right. Love it. Great topic. Great discussion. Thanks for sharing.
Absolutely. Thanks, CB.
All right. We'll see you.
Bye-bye.